very severe condition. But then everything here is pimples only. I mean, it's an acne, but it is a different stages of acne. So if it is mild, then you have a different way of managing your skin or even treating your skin. If it is a moderate acne, then it's a different way of doing it. And if it is severe, then again it's a very different way of doing it. But everything comes under acne.
Okay. Okay. Everything comes under acne. So is there any age limit where we can get acne? Because obviously people say that it's a teenage. I start getting it sometimes because I am not a teenager anymore for sure. But even I start getting it. So is there any age concentrate where we get it, or it is like non-use of proper things and proper care of the skin?
See, both the things are there. It is definitely age related because you usually start seeing the acne problem coming in teenage, because that is the stage where there are a lot of hormonal changes happening in the body. This is both in boys as well as girls. So usually this is the age when you start off with the acne problem. And if your influence of the hormones is too much on the body, the changes in the or whatever, then this will be a very severe form, or you will have it for a very long period. So at times you see few people, they have a very clear skin, there's hardly some acne and all. So there's not much of the skin related changes which are happening because of the hormonal influence. So that is one thing. Secondly, there is no age limit. Yes, you begin it at the age of puberty, but then you will even have a late acne. At times you will not have an acne in 20s and 30s, and suddenly you will see acne in 40s. This is because again there is a change, especially in women I'm talking about. So after 40, there are again certain changes happening in the body as far as your hormones are concerned. So that time again you may see acne. That's called as a late acne. And not only this, acne is sometimes related to your stress also, and it is related to certain medications also. At times, if you're on certain medications, again you see the, especially again the hormones. If you're on some OCPs or any kind of infertility treatment or something, then you can even see the acne coming into picture. And apart from this age related things, as I told you, there are external factors. Of course, the food habits are there, the stress is there, the environmental conditions are there. So there are so many factors into it.
So it is both for men and women the same criteria. They might have it at any age.
Usually in boys, it is in the initial period, that is in their puberty age. And you will not see much. I mean, the problem of late acne usually occurs in women because, as I told you, there is a hormonal change happening after 40. So late acne, majorly women face.
So can it be avoided by any chance? I mean, are there any ways where we can at least minimize it or protect it or like avoid it?
Sure, yes, they are. We can minimize this definitely. Say there are different kinds of skins. One is a oily skin, second is a dry, third is a combination skin. Now, if it is a oily skin, then this requires maintenance definitely. So your nature of your skin is oily. That is your oil glands, they are basically very active. So that is the nature. That is how your skin is. So you just can't totally stop it. But yes, when you're taking care, certain, maintenance things if you're doing, like be it a diet, trying and avoiding a lot of greasy stuff or too much of oily stuff. And then, in fact, including good salads and all in your diet, consuming a good amount of water. This is one of the care as far as internally is concerned. Externally, again, what kind of products you're using. See, oily skin people, they just can't go and use any kind of a cosmetic product because the moment you start using something, the acne would start. So you have to be very careful in selecting your products, like avoiding the cream forms and gel forms you have to introduce. And the makeups and all, again, you have to be very selective. We normally get, usually we even get in the market the makeup for the oily skin. So
Ma'am, your thing got mute.
external care. So, so one is the diet, one is what you're doing externally matters, and then your lifestyle. So the stress, as I told you, the stress related things are there. So when you're too much of stressed and all, then you will see the acne. So you have to introduce some kind of, exercises, some sort of meditation and all, just to calm down, because again, that it is which is a stress related acne. So when you're following these things, so when you know your skin, everybody is different. Okay, so to the, in a very, they will respond in a very different way to a similar pattern. So you have to be very selective as to uh, what you have to do to maintain your skin. So people who are with an oily skin, they have a different way of maintaining it. People with a dry skin, they have a very different way of maintaining it.
Okay. So what are the kind of treatments which is available after this? Means these are the preventions we can take, but apart from that, we will definitely get it at some point of time. So what are the treatments after that, ma'am?
Yeah. Now, once you analyze your skin and you know what kind of a skin you have, and you start maintaining it, right? You see some results. Now, if it is a very mild problem, like very mild acne, then probably it may get controlled with your home remedies or your lifestyle or your diet and things like that. But if it is moderate to severe acne, then you need a medical intervention.
Hmm.
Now, what happens? Any patient, when comes to the cosmetic clinic, and it is basically you need to do a hormonal assessment, especially if it is an acne which is from too long period, which is not responding to the minor things, or probably the medication taken and also not responding. Then first a complete analysis has to be done, whether there is any kind of a hormonal imbalance in the body, especially in women. So a complete assay would be done, a hormonal assay, and if at all nothing is there, everything is normal, then we will go ahead with only the treatments. Like treatment starts basically from peels, to bring down the acne. And then we have things like microdermabrasion, because acne doesn't come, individually. It will
Hmm.
come with the secondly, like, after the acne heals, you will have dark spots, then the scarring problem and everything.
Hmm.
So we'll have to treat acne completely. I mean, in a holistic way. We just can't suppress the acne and send off the person with all the spots and the scars on.
True.
So we'll have to use the treatment modalities are different here. Peels, and in peels also there are different peels. Is it a mild or a moderate or an advanced peel which you're using? Because certain people who are working and who can't stay at home, so we can't use certain very advanced peels which you gives downtime and things like that. So in that also we'll have to be very selective depending upon your lifestyle, your the acne severity of the acne. So this is about the peels. Then we have other options like microdermabrasion. We have microneedling treatments. This is done especially for people with a lot of scars and all. Then we go for an option of microneedling or microneedling with radiofrequency combination. But this requires a series of sessions to be done. You can't expect that your things will vanish in a 1 or 2 sessions in a day and things like that. So once you're doing this, along with that, you have to take care of your diet, your maintenance products and everything. And in cases where the acne is very severe, like when we check with the hormonal assay, and if there is any kind of a problem, like, there are, uh, the hormones like the estrogens and the testosterone are not in balance, then it needs an intervention of the gynecologist too, or the endocrinologist. So in that situations, what we do is we correct the hormonal imbalance with the oral intake of medication. And apart from that, externally, we do the cosmetic treatments.
Okay. So even some blood tests also are done, ma'am, during the acne and pimples problem when it is aggregating a lot more.
Yeah, the hormonal assay which I was talking is nothing but through the blood investigations. So normally, see, to know the status of your hormones, we require the blood investigations only. Apart from that, sometimes we may need an ultrasound also.
Hmm. Oh, okay. So you just mentioned that there is some word called PCOD, ma'am. Even I have heard that word, but elaborately we don't know. We know that it occurs with the women, and there are some hormonal problems is there. But what exactly is PCOD, and can that be managed? And how do we know that we have PCOD? What are the symptoms?
Yeah. See, PCOD is a very major problem in women. Usually, this is nothing but your polycystic ovarian disease, or we even call it as polycystic ovarian syndrome. Now, in this, it is not one entity which is disturbed. It is almost the entire balance of your body which is disturbed because of the hormones. So, what happens is when your hormones are not in a right quantity or the right ratio in the body, that disturbs the entire system. Now, this PCOD usually occurs when the girls start with their puberty.
Okay.
So once they start with the puberty, the first problem which they see is usually the periods get irregular. And then after that, there are signs like, you get a lot of acne on your skin. You may get, there may be a lot of hair fall, not a normal hair fall. It's going to be an unusual hair fall or a very thin hair, acne kind of a problem coming in a teen kind of stage. It could even into the form of hirsutism. Hirsutism is nothing but the unwanted facial hair. This is another sign which we can see for PCOD. They may or may not be obesity also. So usually there is again a weight gaining history, and this weight is so stubborn that if you're dieting or if you're exercising too much, whatever you're doing, gymming and all, you will not see much of a change. So these are the usual presentation of a PCOD. It could be an acne, it could be a unwanted facial hair, it could be loss of hair or thinning of the hair, baldness, and then obesity.
So this treatment will be again, it will take time. It can be treated, or it can be.
See, it can definitely be treated, but again, it has to be a holistic approach. So
Okay.
it starts from, first of all, in cases of PCOD, we recommend a diet change. The diet doesn't have to be like a strict dieting, but cutting down on your carbohydrates is a must. So you have to minimize your carbohydrates in the sense your rice, your wheat, or too much whatever you're consuming, that has to be cut down. And then you'll have to concentrate on your protein intake, and consume lot of fiber food and everything. And along with that, you have to be active. See, activity plays a very important role in case of PCOD. So you can't expect that, yes, you're dieting, but then again, if you have a very sedentary kind of a lifestyle, then it is difficult. So you have to be active, you need to exercise, you need to take care about your diet also. And along with that, we can treat, see, there are different modalities of treatment, and in the sense, at which stage the client is coming for the treatment also. So there is an oral medication which is prescribed for PCOD. There are certain hormones also which are prescribed for PCOD. So apart from that, yes, then we can do the external treatments for your facial, unwanted facial hair, like we do the laser treatment. And then for acne, yes, as I told you, there are different kinds of peels and the other kind of treatment modalities. And thirdly, for your hair fall, yes, again, we have different treatments for hair fall, like we do a mesotherapy or we do a PRP. So overall, yes, it will improve, but provided if you have any kind of a PCOD, it has to be treated internally as well as externally.
Okay. So when you say laser, ma'am, I have heard that laser, once we do it, we have to keep on doing it the entire life, or it will leave some scar. And more we get it, we get more thicker hair. Is it like a myth, or it is true?
See, as far as lasers are concerned, first of all, lasers have to be handled in a right way. Okay, laser is just not a small thing. So what happens is, in unwanted facial hair, it has to be the right parameter according to the skin type, according to the hair which is present. If you're doing the laser, then results are excellent, and then they are going to be permanent too. So if it is not handled, like, what you're talking is like if the hair will grow more or something like that, that means either you have disturbed your hair which was normal. That is, see, normally when we have a layer of hair on our body, which is a very like villous hair kind, that is like a protective layer, and we're not supposed to disturb that hair. The laser is meant only for the unwanted facial hair, the hair which is very thick very coarse, especially on the face.
Hmm.
So if you are doing a laser, then it has to be done on the hair, which will respond with the laser, and not on all the hair, which will, I mean, the villous hair, again, if you're disturbing, it is like you're triggering a hair growth again. So lasers, yes, they will definitely give good results, provided it is done in a right way. You have to be in the hands of a right expert. And talking about the laser burn, yes, there were certain cases reported, but again, I would say if it is neglected, it is again a part and parcel of negligence. Provided if you do it like as I told you, you have certain different parameters for your skin, considering your skin, the color of your skin, the color of your hair, the thickness and all. So if you're setting good right parameters, then you will not have cases like burns and all.
So even the color of the hair matters with the laser thing?
Yes, color of the hair and color of the skin also matters. See, you may have the color which is very light, or you may have a very dark, thick kind of like if you have a gray hair on, if you're coming for a laser, and if you're expecting along with your darker or the black hair, the white hair, which is a gray hair, will also go. No, it doesn't happen, because the laser will not respond to your gray hair, because the
Okay.
laser needs a medium. Laser needs a medium right from the top of the skin layer. It has to penetrate and go deep into the layer, your skin, where hair follicle is embedded into the dermis. So
Okay.
that needs a medium called as melanin, which is there into our hair. So if
Okay.
there is no melanin, then the laser doesn't have a medium to penetrate into the hair follicle. So laser basically doesn't work on a gray hair.
Any age considerate for doing the laser, or like we can do it as soon as we become a teenager or we cross the puberty age?
The minimum age requirement is at least you have to wait 1 hour from the menarche. Like since the girl has attended her period, at least minimum 1 year.
Oh, okay. From then it's not
Yes,
harmful. We can do it.
we can do it, but provided, as I told you, it has to be done only on the unwanted facial
So you also
hair. Like
mentioned some, yes, ma'am.
yeah, in this situation, usually we get clients, in this age, basically for underarm, and the upper lip. These are the common areas at that age which we get.
The men also they do the laser?
Men, yes, for the cosmetic purpose, they do it,
Okay.
and especially men who are into, and glamour industry or whatever, they get it
They
done.
do
Full
it.
body lasers also.
Okay. So you mentioned one word was PRP, ma'am. So
Mhm.
that's for hair or skin?
Yeah. PRP is like, it's both for skin as well as hair. The
Okay.
concept here is what we're doing in PRP is it is like a platelet rich plasma.
Okay.
So the patient's own blood is drawn in this procedure, and it is immediately put under a centrifuge. So
Okay.
centrifuge is a process where, in the blood, there are different cells like RBCs, WBCs,
Yes.
platelets.
Hmm.
So in the process of centrifuge, what we do is we separate the RBCs, WBCs, and then we get the pure platelets.
Okay.
Okay. So we do this procedure, we collect those platelets, concentrated platelets, and then we treat the person with their own platelet. Like it is
Okay.
something like a rejuvenating thing, right? So
Got
if
it.
we're doing it on hair, what we're doing is the follicles which are very dormant, they're not giving you any kind of a growth. It is like, they're not totally dead, but they are inactive. So once we induce this platelets into the hair follicle through your scalp, there are certain pores on the scalp. So we do a procedure with either a microneedling or a roller. We open up the pores, and then we induce these platelets or the PRP. So it is basically again reviving your cells so that in future slowly you can see the growth happening in these follicles. And on the face, yes, again we do it, the PRP. Here what is happening is it is again, as I told you, it is rejuvenating. So your collagen is coming down as you're aging, you're getting dullness, you start with some sort of wrinkling. And not only that, but again, if there are certain scars on your skin, we can do PRP.
Okay. So we cannot just walk in and ask you for a PRP. You will only suggest if it is required or not.
See, in my clinic, yes, we do have people who sometimes just barge in and ask for PRP and things like that because they go through the net and come down. But in such cases, what I do is first I do a facial assessment. Yes, you want a PRP, but what is the major problem, right? So we need to know what is the concern of the patient. So I do a complete facial assessment. Then I take the concerns of the person. Like if the person says I have dark circles, I'm feeling as if my skin has gone dull, or I have too much of wrinkling, then accordingly I will suggest the program.
Okay. Okay.
See, the program could be either a PRP or a peel or a microneedling, or at times if I feel the wrinkles are too much and the dynamic lines are too much, which will not respond to PRPs or microneedling or peels, then we go with the high-end procedures like Botox, or we go with the lifting procedures like HIFU also.
So Botox is like for everything, ma'am. I mean, Botox is just what we know is just to reduce the lines and all. And there is a lot of myth about Botox. It is not safe, and there might be some problem with the eyesight if you are doing in the profits and all. Is it true?
No, these are with myths with the Botox. See, what is happening with Botox? It is a protein derivative, and it is relaxing your facial expression lines. It is
Okay.
the dynamic lines. So whenever we create some expressions, like if a person has a habit of smiling a lot, then you will
Hmm.
see the lines develop around
Hmm.
the eyes, which we call
Hmm.
as prophy. And if you are an angry person with nature and all, then you will see a lot of forehead lines developing and the frown lines and all. So Botox is used to treat such lines, and
Okay.
it is a very temporary effect. See, the Botox units which we're using in cosmetic procedures, it is very, very, very mild concentration. Otherwise, the Botox is also used in certain therapeutic conditions. In certain medical conditions also, the Botox is used, but that is in very, very high doses. So in cosmetic procedures, we use in a very mild concentration and very mild dosage also. So once we do the Botox, the effect would be there for about 4 to 6 weeks. And once the drug gets, degraded from the body, you will just get back to normal as what you were earlier. It is nothing like the myth is like once you take a Botox, you have to keep on taking for the lifetime. And no, it doesn't happen. And it has nothing to do with your eyesight too.
Because I have heard with one of the person when she wanted to take it for this area, she had some fine lines here, and she lost
Hmm.
an eyesight for about 3 months. She was not able to see with the left or right eye the side it was done. So after 3 months, she again started seeing it properly. It was blur vision for her. So maybe it is not done technically correct
Which
or not with
area,
the professional.
no, which area did she get the Botox done?
She got it for this crow feet, ma'am. I think this part was very shaggy, so she got it done.
At times, what happens is Botox has nothing to do with the eyesight, but it has to do with the muscles. Now you have lot of muscles which are surrounding your eyes.
Right.
So you have to be in a right plane and you have to target the right muscle when you're doing the Botox.
Okay.
Okay. So if it is like, if you have to inject in a right muscle, then the results are good. But if you have injected into the wrong muscle, like around the eyes, there's so many muscles. So
Hmm.
if you get into some muscle, see, probably it must have been because could be, I really don't know, could be maybe the upper eyelid muscles which were probably relaxed a bit and which were interfering into the vision and all, probably has created some sort of an indirect effect on her sight. And as you've seen, when you say after 3 months, then this problem had gone. That is because the effect of the Botox is gone.
Correct. Correct.
So provided it has to be done again in a right way, you just have to be very careful when you're injecting because you should know the anatomy properly. Again, you have to be in a right hands definitely for Botox.
So again, coming back to the same question, ma'am, is Botox having a certain age or till what age can a person do? I like a person who gets the wrinkles and all, even they can do it.
Yes. Botox, usually we get this indication for the anti-aging only. I mean, people with 40s usually come for the Botox because that is the time they start off with the lines and everything. But yes, we can even have a person in 20s and 30s also, because as I told, if you are into the expression lines matters. If you're having a habit of smiling too much, you will get around the eyes. If your skin is too dry, then you may get the wrinkles too early. Or if you are in a profession where you're exposed to a lot of UV radiation, then you may get, this is something like premature aging. So the person may come in 30s also for it. And at times, not only the indication is for anti-aging, it is also for facial contouring. Contouring in the sense, you sometimes see young girls or boys with a lot of volume on their face, or probably a broad face, which will make them look a little aged. So
Right.
such people contour them also, especially we call it as a masseter botox. Masseter is like, suppose if this part of your face is too broad, that gives you a very aged look.
Right.
So you want something like a contouring. You want to just slim down this lower
Hmm.
portion at that period. Also, in such young, boys or girls who come to us for that.
So Botox is different and threads are different, ma'am. Ma'am, can you hear me?
Yeah, yeah. There's a net
Network
issue,
issue.
it was.
It is there, ma'am. So we were
Yeah.
talking about the aging thing, ma'am. When you said aging, is it just the age aging, or do we have the skin aging, or do we have other things also which we can consider as aging?
Yeah. See, aging is basically, there are two different kinds. One is an extrinsic and the other is an intrinsic. So intrinsic is like predetermined into your genes. It is like it comes in families. It is not, it is majorly in families and in your genes. So sometimes you'll see at times there are a few ladies which prematurely age, and in the families also it goes like that. And sometimes you will not see, like you will see even ladies with 50s and all with not too much of wrinkling and all. That is all determined by their genes, and that is intrinsic aging. The second thing is an extrinsic. Extrinsic in the sense it is influenced by your lifestyle, your diet habits, your your sun exposure, your stress factors, and how you have maintained throughout your period of, let's say, after 25 or so. So that is all the external factors, and in fact, smoking and also tobacco chewing, that will also influence your skin. You get a lot of aging when you are into a lot of smoking and tobacco chewing also. So they are basically, the extrinsic is one which is under our control. You can modify your dietary habits, you can modify your lifestyle and everything, and then you can control it. Whereas intrinsic is not in your hands, it is all depending upon the genes. So the treatment option, yes, for both the things are the same, but you have the cosmetic treatments of anti-aging, which will work even on extrinsic as well as your intrinsic aging.
So what are the treatments for the aging, ma'am?
Now, in this, it depends upon what stage of aging you are into. Like if you've just started with, with just a mild wrinkling on your skin, which happens into your 30s and all, and then with a little bit of dullness and things like that, then you can manage it with very mild procedures. Like we have microdermabrasion procedures, we have microneedling procedures, we have radiofrequency procedures. But if the aging is again advanced, like if there is a lot of muscle sagging, and then the facial pads, which are nothing but the face pads which are just sagging and all, then at that period probably you will need something called as the thread lifting procedures. You may sometimes even need fillers to give a volume, especially in the mid phase, under your eyes and all. When you see the hollows developing and all, you will need fillers at that particular stage. Then, or you may need the hypho lifting also. And if it is too much of aging, as I was telling you, like after 50s and all, where your subcutaneous fat is totally gone, then you need lot of volumization kind of fillers. So it all depends. The anti-aging treatments are right from basic to advanced, but it depends upon what stage are you approaching.
So even in the aging, do we consider the diets and all? Is it required? I mean, proper diet is required to minimize it.
Yes, in any kind of aging stage, be it an early aging or a late aging or a premature aging, diet also has to play a very important role, because what is aging? It is nothing but it is related to your collagen and elastin. So this is something, these two components, collagen and elastin, help to maintain a volume and give, the tightness to your skin and hold on your facial ligaments and everything. So when you take a good amount of diet, like especially with the proteins and all, it helps you to build up your collagen levels, and it will definitely show a difference, or probably it will help you to, postpone this aging for quite some time again.
So we have been asked by one lady that she is pregnant 3 months and she want to go for the laser or peels, any kind of thing, because both have been asked her to get it done. So is it okay for her to go now, or shall she wait for some time?
See, in cases of pregnancy or not, I wouldn't recommend any cosmetic procedures. It is better to delay, because, see, first of all, in pregnancy, there is a lot of hormonal changes going on in the body. So because of these hormones, you will see the changes on your skin happening automatically. Especially, you will see a lot of pigmentation.
Right.
Melasma is another condition which usually develops. Neck pigmentation is there.
Hmm.
Striae marks stretch marks and all, they come into picture. So that is not the period where you have to get it treated. Once your entire pregnancy period is over, and then, with a gap of at least, 3 months, then you can start off with these cosmetic procedures on a safer side.
They can do during the breastfeeding? No, they can't.
Breastfeeding, certain cosmetic treatments are okay, like, if you're going for some anti-pigmentation treatments, and if you're opting for some peels, there are certain peels which are indicated. Some peels which specially have this retinoic acid component are usually contraindicated with pregnancy as well as breastfeeding too. Apart from this, other kind of appliances, like, as I told you, after 3 months, if you want to go something for your stretch marks, yes, you can go, because it doesn't require something which is penetrating inside your skin. It is all external. You can go. Or if you're planning for a tummy reduction program, yes, you can go.
Ma'am, I have also seen some people, they get the derma rollers and they start doing it at home for the face or for the hair. Does it really helps or it doesn't? Because some people say yes, we are getting results. Some says no. So how it is different?
See, these days we are getting these products online also, but then there is a lot of difference between what you're, getting those products and doing at home, and getting things done with an expert. Because, see, everybody's skin is not the same. The problem is not the same. So you just can't expect that somebody's picking up a roller, which rollers are again in a different form. Their length of the needles matter, the number of the needles matter, and when you're doing the procedure, how deep you're going, or how superficial you have to be. All these things matter. So definitely, I wouldn't recommend people to just try something or experiment on yourself, because it is again your face, especially your skin. It is better to get the procedures done either with your dermatologist or the cosmetologist.
So, what is the right time we should means there should a bell ring that yes, this is the time we should visit a dermatologist, or because normally what the people are doing is, even for the peels, when you talk about peels, we get a lot of products where it says you have like peeling effect. So is it that peeling effect or it is something different? And when we should like, okay, now stop it and we have to visit a doctor?
See, when we talk about the peels and the right time of starting the treatments, first of all, the basic care of the skin has to be there. As you're exfoliating on and off, you're moisturizing your skin, and you're using a sun protection always. So these basic things, and your, of course, water intake and your food. So
Hmm.
first it has to be with this, and then after that, if you're happy, or probably if it is working till certain period, and after that you don't see much change happening, or you see some problem coming in, like it could be an acne, or it could be some pigmentary patches, blemishes, whatever, then it is better to consult a doctor. Now, this is the time when you have a problem. Let's say if you don't have a problem, yes, you are happy, but then you see that there is a lot of change on your skin, you find it very dull, you're no more glowing as you used to be there, as your skin used to be earlier, then that is again the right time to, and of course you're beauty conscious too, then that is the right time to approach the doctor.
Okay. So my question is, this is my personal question. There are so many kind of peels in the market, ma'am. When we go to one doctor, they will suggest something else. So we are like very much confused. Some will say that there will be a lot of peeling, like the entire skin would come out. But some says it is only the redness which is there. And then we have to maintain after that also. We should not be exposed to sun for some time. So how many kind of peels are there, and how much maintenance do we really need? Because we working people will have to go to exposed to the sun, ma'am. We cannot just avoid it.
True. See, what happens is, now if you're getting with the peel treatments, there are different kind of peel treatments here. Right now, there are advanced peels. See, earlier we used to get very crude peels where a lot of burns used to happen. There would be a skin irritation and all. But now the peels are, it's like user friendly now, They will not cause much harm or irritation on the skin, and they, at the same time, they will give you good results. So usually if I get into the classification of peels, it is, one is a very mild or a superficial peel, which is not giving you a visible exfoliation or a rash happening on the skin. The second category is the medium depth peel, Well, yes, you see a bit of downtime. That is your skin when it is peeling off, it is dry, you see the skin layer coming out, and then you need a good amount of sun protection. You may continue with your work. If you're not comfortable, you may have to stay at home. And the third category is the deeper peels. So deeper peels is like, they cause too much of downtime. Like, see, if you ask me for a fairness kind of a treatment, they are very different kinds of peels. It will be a basic peel to an advanced peel. So if a person wants to have a very good change, a drastic change in the color, and then in a short period, then it is like straight away I'll recommend an advanced peel. But at the same time, you have to be prepared with the downtime. In the sense, when we apply a very advanced peel, there'll be so much of layers and layers of your skin coming out, too much of dryness and everything. You have to stay indoors for about, let's say, a week's time or so, and do a lot of moisturizing and everything, sun protection. And yes, after that, the results are amazing. But if a person comes like, a working lady, not too very keen about the color, but yes, wants a uniform, complexion, the patchiness and all to be gone, the tan has to come down, and then she just can't, bear the downtime. She just can't stay at home, and she has a lot to, move about in the sun. So we can go for a basic peel, which is again very safe, but provided the sunscreen has to be used after the procedure on a regular basis. You will not see any kind of a skin peeling in this situation, but at the same time, you will get the glow. And this will require repeated sittings. Like, if it's a slow and steady process, if it is a mild peel. And if it is advanced peel you want in one shot, yes, that is also there. But then again, there is a downtime, and you need to be stay at home indoors.
So there's a lot of things in cosmetics, like we don't know. There are, every time we talk to you, we get a new term. There's a peels, there are needles, there are threads. So everything we can get it at your clinic at Aesthetic, right, ma'am?
Definitely, right from the basic to advanced, I have everything here. See, it all definitely the patient's concern matters. See, if I have a technology and I want to use it on you, but you are not happy with it, it doesn't make any sense. So first, the patient concern would be important. See, I have a treatment, as I told you, of fairness, which will be given in one sitting also. But if you are a person who can't accept the downtime, then you will not be happy. So
True.
when I do a facial assessment, I definitely, first priority will be the patient's concern. What is the patient wanting, first of all? What I see with my eyes, I see 100 things on the face. But if it is not the patient concern and I'm doing what I want, doesn't make any sense. So that also, see, the cosmetic treatments are just not that you do and send the patient off. It requires a lot of counseling, because the patient also has to be mentally prepared as to what you can expect out of it. If I'm doing a fairness treatment and I can give you 2 to 3 shade lightening, which is a practical thing to, and happen. But if you are expecting that a dark person totally converting into a fair person, which is not happening. So the counseling plays a very important role before I do a session. Something, it is similar with the anti-aging treatments. If a person is coming in an early stage, right, then we can give amazing results as far as lifting and all is concerned. But if a lady with 50s and 60s, then the expectations it has to be like, you will improve a lot. But then you can't expect things to happen as you were in 30s or 40s.
True.
So definitely the consultation has a lot of importance, because the counseling as to what kind of expectations you can have with the treatments is very important.
So tell us something about your clinic, ma'am. We know it is in Maritpalli. So apart from the Sikandrabad side, can we also catch you up somewhere else? And we would like to know about your clinic as well.
Yeah, the Aesthetic Cosmetology Center. I have been into this field more than 10 years, of course, and I was working with different companies earlier, and now of late I've started my own practice. Now, it is a setup, see, I would say it is not too commercial kind of a setup. It is because I want even the middle class people also, to come down and try these treatments, because usually there is a myth, like, when it comes to cosmetic treatments, people say they're too expensive and they just don't want to get in and all. But here I'm very flexible and very reasonable with the pricing too. And my major concentration here will be on the results of the person. So the quality of the product which I'm using definitely matters. It is definitely all the FDA approved kind of a products which I used in my clinic. And then I make sure that, uh, at least I reach the expectation of the client, very close to the expectation of the client. So results definitely matter in my clinic. And apart from this branch, yes, I do also consult at Banjara Hills, but just because at this time being, because of the lockdown and the COVID crisis and all, so I'm not taking up the appointments there, but then eventually in future I would again restart there. As of now, the Maratpalli clinic is operating.
So what are the timings, and are you there every day or you have like days fixed?
It is all again with appointments. Yes, the clinic is there every day, right from 11 to 7 in the evening, but again with prior appointments.
It's only on the prior appointments. We can just contact you over the phone and we can fix an appointment and we can come to you.
Yes,
And
definitely.
you will be
Yes, I will be.
there. Because we know if you are there, everything is good, ma'am. Because yes, there are so many terms, and it was like a very good session, ma'am. We came to know so many things, and we know that everything cannot be treated at home. PCODs we have understood. We have understood so many kind of peels, threads, and Botox. We have understood the age also, till what age to what age, and I'm sure there are more beyond this. This is just introduction.
Yeah.
So we'll just get this over, ma'am, and thank you so much for coming on the show. We'll just get in touch with you, and
Thank
I'll
you
be
so much,
sharing you
Pavitra.
guys. Thank you, ma'am. I'll be sharing you guys the address and the phone number on the link. You can just get in touch with Dr. Firdous Ibrahim, and you can get yourself beautiful. Thank you so much, ma'am.
Thank you.